Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about fetal circulation, so go ahead, subscribe, and let's get started. In this video, we are going to learn about fetal circulation. This is a very important topic because it helps us understand how the baby receives oxygen and nutrients while growing inside the mother's uterus. So what is fetal circulation? Fetal circulation is the movement of blood inside the baby's body before birth. It is a special type of circulation that is different from the circulation we have after birth. Now you may have a question. Why is it different? The reason is that the baby's lungs are not working inside the uterus. The baby is not breathing air before birth. Since the lungs are not functioning, they cannot supply oxygen to the blood. Then where does the baby get oxygen from? The baby receives oxygen and nutrients from the mother through the placenta. The placenta acts like the baby's life support system. From the placenta, oxygen-rich blood travels to the baby through the umbilical cord. So, remember this simple point. Inside the uterus, the placenta works like the baby's lungs. It provides oxygen and nutrients, and the umbilical cord carries this oxygenated blood from the placenta to the baby. This special circulation continues throughout pregnancy. After birth, when the baby takes its first breath, the lungs start functioning, and fetal circulation changes into normal circulation. So, in one sentence, we can say that fetal circulation is the circulation of blood in the fetus before birth, where oxygenated blood is supplied by the placenta through the umbilical cord, because the fetal lungs are not yet functioning. Dear students, before we understand the pathway of fetal circulation, let's first learn the important parts involved. There are 6 main structures, and each one has a special function. First is the placenta. The placenta is the organ that connects the mother and the baby. It supplies oxygen and nutrients to the baby and removes waste products. You can simply remember it as the baby's lifeline inside the uterus. Next is the umbilical vein. There is only one umbilical vein. Its job is to carry oxygen-rich blood from the placenta to the baby. Remember this important point. One umbilical vein carries oxygenated blood. Now let's talk about the umbilical arteries. There are 2 umbilical arteries. They carry oxygen-poor blood and waste products from the baby back to the placenta. So, remember this as 2 arteries carrying deoxygenated blood. The next structure is the ductus venosus. This is a special blood vessel present only during fetal life. It allows most of the oxygenated blood from the umbilical vein to bypass the liver and reach the heart quickly. This helps the oxygen-rich blood reach important organs faster. Next is the foramen ovale. This is a small opening between the right atrium and the left atrium of the fetal heart. It allows blood to pass directly from the right side of the heart to the left side, bypassing the lungs because the lungs are not functioning before birth. Finally, we have the ductus arteriosus. This is another special blood vessel that connects the pulmonary artery to the aorta. It diverts most of the blood away from the lungs and sends it directly into the body's circulation. So, to summarize, remember these 6 important parts: placenta, 1 umbilical vein, 2 umbilical arteries, ductus venosus, foramen ovale, and ductus arteriosus. Dear students, now let's see the pathway of fetal circulation step by step. It may look lengthy, but if you understand the flow, it becomes very easy. Let's start from the placenta. The placenta is the place where the baby receives oxygen and nutrients from the mother's blood. So the journey of oxygen-rich blood begins here. From the placenta, the oxygenated blood travels through the umbilical vein. Remember, there is only one umbilical vein, and its job is to carry oxygen-rich blood from the placenta to the baby. Next, the blood reaches the ductus venosus. This is a special blood vessel found only in the fetus. Instead of passing through the entire liver, most of the blood bypasses the liver through the ductus venosus. From there, it enters the inferior vena cava, which carries the blood towards the heart. Now the blood enters the right atrium, which is the upper right chamber of the heart. Normally, in adults, Blood from the right atrium goes to the lungs. But remember, the fetal lungs are not working, so the blood takes a shortcut. This shortcut is called the foramen ovale. Through this opening, most of the oxygen-rich blood moves directly from the right atrium to the left atrium, completely bypassing the lungs. From the left atrium, the blood flows into the left ventricle. Then, the left ventricle pumps the blood into the aorta, which is the largest artery in the body. Finally, the oxygen-rich blood is distributed to the most important organs, like the brain, heart, and the upper part of the body. These organs need a good supply of oxygen because they are growing rapidly during fetal life. Dear students, now let's continue with the second part of fetal circulation. We have already seen how oxygen-rich blood reaches the brain and upper body. Now let's see what happens after the blood has supplied oxygen to these organs. After supplying oxygen to the brain and upper part of the body, the blood becomes deoxygenated. This blood now returns to the heart through the superior vena cava. The superior vena cava carries this oxygen-poor blood into the right atrium. From the right atrium, the blood moves into the right ventricle. Next, the right ventricle pumps the blood into the pulmonary artery. Now, in a normal adult, blood from the pulmonary artery goes to the lungs to receive oxygen. But in the fetus, the lungs are not functioning because the baby is not breathing inside the uterus. So only a very small amount of blood goes to the lungs for their growth and development. What happens to the remaining blood? It passes through another special fetal shunt called the ductus arteriosus. This blood vessel connects the pulmonary artery directly to the descending aorta. So instead of going to the lungs, most of the blood bypasses the lungs and enters the descending aorta. From the descending aorta, the blood is distributed to the lower part of the baby's body. Finally, after supplying the lower body, the deoxygenated blood returns to the placenta through the two umbilical arteries. Remember, there are two umbilical arteries, and they always carry oxygen-poor blood from the fetus back to the placenta. In the placenta, carbon dioxide and waste products are removed, and the blood receives fresh oxygen and nutrients from the mother. Then, the whole cycle starts again. Dear students, now we are going to learn about the 3 fetal shunts. This is one of the most important questions in fetal circulation. If you understand these 3 shunts, fetal circulation becomes very easy. First, what is a shunt? A shunt is simply a shortcut. In fetal life, some organs are not fully functioning, so the blood takes special shortcut pathways. These shortcuts are called fetal shunts. There are 3 fetal shunts. Let's learn them one by one. The first shunt is the ductus venosus. The ductus venosus is a blood vessel that allows oxygen-rich blood coming from the umbilical vein to bypass most of the liver. Instead of passing through the entire liver, the blood goes directly into the inferior vena cava and quickly reaches the heart. So remember this simple point. Ductus venosus means bypasses the liver. Now let's move to the second shunt, the foramen ovale. The foramen ovale is a small opening between the right atrium and the left atrium of the fetal heart. Since the lungs are not functioning before birth, there is no need for all the blood to go there. So, most of the blood moves directly from the right atrium to the left atrium through the foramen ovale. This helps the blood bypass the lungs and reach the body quickly. So remember, foramen ovale is the opening between the 2 atria, and it bypasses the lungs. Now, the third shunt is the ductus arteriosus. This is another special blood vessel that connects the pulmonary artery to the aorta. Normally, blood from the pulmonary artery should go to the lungs. But because the fetal lungs are not working, most of the blood passes through the ductus arteriosus and directly enters the aorta. Again, this is another way of bypassing the lungs. Dear students, till now we have learned how fetal circulation works inside the uterus. But what happens after the baby is born? This is another very important topic. The moment the baby is born and takes its first breath, the lungs start functioning. The baby no longer depends on the placenta for oxygen. From now on, oxygen comes directly from the lungs. Because of this, the special fetal shunts are no longer needed. They gradually close and become ligaments. First is the ductus venosus. During fetal life, it bypasses the liver. After birth, once the umbilical cord is cut, blood no longer comes from the placenta. So the ductus venosus closes and becomes a fibrous structure called the ligamentum venosum. Next is the foramen ovale. Remember, this was the opening between the right atrium and the left atrium. After birth, when the baby starts breathing, pressure inside the left side of the heart increases. This causes the foramen ovale to close. Later, it forms a small depression called the fossa ovalis. Now let's look at the ductus arteriosus. During fetal life, it connected the pulmonary artery to the aorta and helped bypass the lungs. After birth, since the lungs are now working, this connection is no longer needed. So the ductus arteriosus closes and becomes the ligamentum arteriosum. Now, what happens to the umbilical vein? The umbilical vein carried oxygen-rich blood from the placenta to the fetus. After birth, it is no longer required. It closes and becomes the ligamentum teres of the liver, also called the round ligament of the liver. Finally, the two umbilical arteries. These arteries carry deoxygenated blood from the fetus back to the placenta. After birth, they also close. Their distal portions become the medial umbilical ligaments. Dear students, before we finish this topic, let's quickly revise the important points that are frequently asked in exams. These are the points you should always remember. First, remember that the placenta is the site where oxygen and nutrients are exchanged between the mother and the baby. You can simply say that the placenta acts like the baby's lungs inside the uterus. Next, there is only one umbilical vein, and it carries oxygen-rich blood from the placenta to the fetus. This is a very common exam question. Now, remember that there are two umbilical arteries. They carry oxygen-poor blood and waste products from the fetus back to the placenta. Another important point is that the fetal lungs are non-functional before birth. The baby does not breathe air inside the uterus. That is why the placenta supplies all the oxygen needed by the fetus. Since the lungs and part of the liver are not fully functioning before birth, the fetus has three special shunts that help blood take shortcut pathways. These three fetal shunts are ductus venosus, which bypasses the liver; foramen ovale, which carries blood from the right atrium to the left atrium and bypasses the lungs; ductus arteriosus, which connects the pulmonary artery to the aorta and also bypasses the lungs. Finally, after birth, when the baby takes its first breath, the lungs start working, the umbilical cord is cut, and these three fetal shunts gradually close. This changes fetal circulation into normal circulation. So, if you remember these 6 points, you can easily answer most exam questions on fetal circulation. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.